What is the European Health Data Space, and who will benefit?
It's a proposal from the European Commission for regulations which will make it possible to share, use, and reuse health data as to improve the quality of healthcare and to support research, innovation, and policymaking within countries and the European Union. The proposal will provide citizens with better digital access to their personal healthcare data and provide them with better control over its movement and its usage. It will establish rules for the use of non-identifiable health data and also support the use and reuse of these data.
What are some key concerns?
We welcome and support the European health data space, but as with all ambitious proposals, there are some considerations. Firstly, regarding health data sharing, the European health data space must carefully consider which data are being collected and how they are included. Quality primary data are needed to support secondary uses. As healthcare professionals are the data providers, the Biomedical Alliance is concerned about an undue burden of responsibilities and workloads being placed upon them. Secondly, regarding regulatory clarity, the resulting legislation must be proportionate, fit for purpose, and align with pre-existing legislation. The Biomedical Alliance is concerned the legislation is unclear, then it may hinder rather than facilitate the data access necessary for improving the lives of citizens through research and public health. And thirdly, stakeholder involvement. The Biomedical Alliance thinks that all viewpoints must be heard from healthcare professionals, biomedical researchers, patients, and citizens from the early stages of development through to the implementation and operation of the European health data space. Without this, we're concerned there may not be enough support for the proposal by medical and scientific communities who are the data providers.
What does the Biomedical Alliance recommend?
We recommend that the European health data space should facilitate the work of healthcare professionals and not lead to additional workloads, and that it accounts for potential issues about costs and infrastructure requirements as to ensure the interoperability of the data and systems. Regarding regulatory clarity, we recommend that the new regulation provides the necessary clarity and harmonization around health data sharing without adding additional complexity to a situation where many legislations overlap and national or local interpretations differ. And finally, we recommend that at both the EU and the national level, that the European health data space includes regulations for the obligatory composition of advisory boards to ensure that all viewpoints are heard at all stages of development. The Biomedical Alliance supports the ambitious European health data space, as we think it has the potential to have a transformative effect on healthcare and research sectors.
My name is Tomislav Sokol, and I'm a member of the European Parliament from Croatia. I have been appointed as co-rapporteur for the European Health Data Space, one of the most important files in health in this parliamentary term.
How will the European Health Data Space help build a European Health Union?
The European Health Data Space will be a specific digital health system comprised of rules, common standards and practices, infrastructures, and a governance framework. EHDS represents one of the central building blocks of the European Health Union and a milestone in EU's digital transformation. EHDS will aim to improve healthcare delivery across the EU by empowering people to control their health data in their home country or in other EU countries. It will make it easier for patients to access healthcare outside of their member state of residence and offer a consistent, secure, trustworthy, and efficient framework for the use of health data. Also, under strict conditions, researchers, innovators, public institutions, or industry will have access to large amounts of high-quality health data, crucial for developing life-saving treatments, vaccines, or medical devices. Last but not least, it will also foster a genuine single market for digital health services and products.
Who are the main stakeholders involved in the development of the European Health Data Space?
The main stakeholders involved in the development of the EHDS are European Commission, the initiator of the proposal, and the European Parliament along with the Council, as they need to amend and then confirm the EHDS proposal. Of course, EHDS will affect many other health stakeholders, and for that reason, I'm in constant communication with healthcare professionals, patients' organizations, and the industry, listening to their suggestions on how to improve this legislative act. To conclude, I think this is a very important proposal that will bring a big change in the way how healthcare systems work in the EU, and mentioned health stakeholders will have a lot of benefits from the EHDS. Thank you.